Hi, everyone. Glad to be here with you all. Firstly, thank you to the National Collaborating Center for Determinants of Health for creating this space. In my formal training in public health and now my work leading policy for a gender equity organization, I find we don't talk enough about the intersection between these two worlds. For me, ultimately, gender is a critical factor in determining access to power, resources, and opportunities, and we're seeing consistently how this is patterned inequitably. Take, for example, one of the key public health recommendations to reduce the spread and flatten the curve, and that is to stay at home and don't go to work. For me, one of the gendered impacts I'm seeing is that it's easy to say, but very difficult to do that for women who make up the majority of essential workers. They are on the front line of this crisis, and as a result, are going to have higher exposure to COVID-19. As Catherine Scott from the Canadian Centre for Policy Alternatives notes, over 50% of all female workers in Canada are employed in occupations involving the 5 C's. So this is caring, clerical, catering, cashiering, and cleaning. And what we are seeing is that they're disproportionately women. So take, for example, personal support workers, 90% of them are women. Nurses, 92%. Childcare workers, 99%. Cashiers, same trend, 84% women. Cleaners, 71% women. You get the picture. And while they are disproportionately women, I have to say we also see patterning where they're more likely to be racialized as well as newcomer women. But we see that despite the fact they do critical work to continue our society, these jobs are more likely to be precarious, short-term, temporary, and without essential benefits like paid sick leave, and also are more likely to be lower income. And one point I want to highlight is often when we talk about the shortages around personal protective equipment during this crisis, it's often in the context of healthcare, but we have to also see how we can ensure personal protective equipment for people in grocery stores, in cleaning occupations, and some of the other occupations where women are disproportionately represented. So we talk to
Anjum?
Oh, yes?
Could you try speaking a little bit louder or closer to your mic? A lot of participants are having a hard time hearing you. Thank you.
Oh, okay, sure. Let me try again. So in summary, the beginning part that I was saying is that women are overrepresented in essential work, but they don't have the benefits they need to be safe. Another hidden crisis within this pandemic, which is very, very immediate and concerning, not just in Canada, but globally, is the rise of domestic violence. So we see, again, public health guidance tells us to stay at home, but in fact, that might be the most difficult and threatening place for many women across the country. It's well documented that in times of uncertainty and upheaval, women bear the brunt. And in fact, the New York Times is characterizing this as intimate terrorism. So in Canada, in many jurisdictions such as York Regional Police, they've actually seen a 22% increase in domestic violence just in March this past month. We're also seeing increases of 30 to 36% in France, China. In some areas during the lockdown, they were seeing increases of 50% of incidents of domestic violence. And the same case in Spain, 18%. And so this can actually look like abusers making it difficult for women to get essential items like hand sanitizer. This can look like increased monitoring of social media communication. It can look like threats to expelling someone from their home and actually following through on that threat. And yes, also increased risk of physical violence. So what are we seeing on the ground? So I work at YWCA Canada, and we're the largest gender equity organization in the country. Our 32 member associations work in 300 communities, and during this crisis, they're continuing to keep their doors open. My colleagues in Yellowknife, Northwest Territories are providing emergency childcare for essential workers. colleagues in Banff and Prince Albert and Saskatchewan are providing shelters, but also creating isolation spaces and quarantine spaces for people who can't do that at home. And we're also seeing in many parts of the country organizations like the YWCA providing food and essential supplies to vulnerable communities like seniors. And so we're seeing that organizations are stepping up, but they're doing more with less, and they're being pushed to the limits. And this is going to have an impact on their ability to recover from this crisis. And what I want to end on is this question that as we move beyond responding to this immediate crisis and start the journey towards recovery, how do we reimagine a society that centers care? As we're seeing, it's what is keeping our society going, from mutual aid networks to organizational responses through forms of structural care like the Canada Emergency Response Benefit. I think what we're seeing is care is essential. So how do we center that in the reimagining of society that's coming in the next couple of months and years to come? There's a real policy window that's open, and I'm looking forward to the conversation about how we can reimagine that policy window. I'll leave it there for now.
Great. Thank you so much for Anjum for really providing us with a really vivid picture of how gender is playing out in the current pandemic. One of the participants in the chat box just shared that in Vancouver they saw a 30% increase in calls for intimate violence only yesterday. So I think some of the experiences you're sharing, folks on the line are really seeing this at a local level. You just ended up saying, how do we think about recovery and centering care, which I agree is a really important conversation for us to continue to hold. I know from some of the responses we got from participants on today's call and also last week that is a theme and an idea which people are holding through this. So really interesting for us to get to that in some of the discussion later.